Hi, I'm Dr. Sylvestre with Focus and Flourish. Let's talk about creating your own suction drain using a Vacutainer. I really like this easy Vacutainer technique because one, it's a suction drain. It's just neater and tidier than a passive type of drain. Also, it's smaller than a Jackson-Pratt, so it's great for smaller wounds and maybe smaller patients as well. It uses materials that are available in pretty much any hospital, and it's very easy to construct. But the best part is it's easy for the owners to manage this drain as well. Let's have a look. Here's what you're going to need. You're going to need a Vacutainer and probably a needle, preferably about a 20 gauge needle. For the tubing, you can either use a butterfly needle, an IV extension set, or an actual IV line. The important thing is that that it either has a needle or you can attach a needle and that it is sterile. I'm going to use an IV tubing for this demonstration. So firstly, open a sterile package of IV tubing. And whatever I'm doing here, you would do for an IV extension as well. Find the part where the needle attaches. Follow the tubing until you find an obstruction, I'm going to say. In this case, it's an injection port. Remove the obstruction. So you have a needle attachment and then only straight tubing, nothing more. Now we need to place some holes in the tubing. So take the portion of the tubing that's away from the needle. That's where we're going to start to fenestrate. Bend the tubing and then using scissors, in this case, just cut the corner of that bend out. It will leave you a small hole. You don't want the hole to be so big that it weakens your tubing. So you don't want the hole to be more than half of the diameter of the tubing. Your next hole you're going to place, put it on the opposite side of the first hole. This time I used a blade, just cutting off the corner of the bend. My next hole is going to be placed on the opposite surface. So I did, maybe the left and the right side, and now I'm going to do the front and the back side of the tubing, if I can say it that way. So bend your tube appropriately so that the corner will be on the front or the back of the tube in relation to your first two holes, and just cut the corner of the bend off. Keep on doing that, either using scissors or blade, until you have a sufficient number of holes. And remember that all the holes must be within the wound. So don't just keep on fenestrating, because if the holes are outside of the wound, well, that's just not going to work. Now, normally we place a drain from inside the wound to out, but because you have this large portion on this particular drain where the needle will attach, you want to place your drain from the outside in, because the larger portion is simply going to create too big of an exit hole to get it through. So place a hemostat within the wound, tent the skin over the end of the hemostat, cut the skin over the end of the hemostat, and poke your hemostat through. Grab your drain and pull it into the wound, ensuring that all the holes are located within the wound. Close your wound. There's my closed wound, because if the wound's not closed, you won't be able to create suction. Once the wound is closed, pretend my wound is still closed. Now you're going to anchor your drain in place, and I like to use the finger trap technique, which is so easy and secure. So place an anchoring stitch into the skin very close to where the drain is exiting, and make a nice secure knot. So I'll do my 4 throws and secure my anchoring suture in place. This anchoring stitch should be relatively loose because this is what you're going to cut when you go to remove the drain. So if it's really tight, it will be difficult to cut. So leave it loose enough that it's going to gape a little bit from the skin itself. You don't need the needle, and so you can just cut the needle off and have two relatively even ends of suture material to work with. Your tubing, your drain is placed inside the V of your two strands of suture material and put a nice square knot over your tubing. Take your two strands below the tubing, crisscross the suture material below the tubing, come back on the top side and place another nice secure square knot, 2 throws. Repeat the going below, crisscrossing, and putting another nice secure square knot, nice and tight. It's going to indent the tubing a little bit. Repeat that at least 4 times. Now that your drain is anchored and your incision is closed, you're going to attach it to your Vacutainer reservoir. So you're going to need a needle. I have a 22 gauge in my hand. It's what I happen to have. I recommend, if you can, get a 20 gauge needle. Don't let the needle get stuck with maybe a clot or something like that. And just insert the needle in your Vacutainer. Change the Vacutainer as frequently as necessary, but at a minimum once a day. Because if your Vacutainer has lost its vacuumability, you won't know it. It's not collapsing like the Jackson-Pratt reservoir, so you can't see it. So at least change it once a day. Anchor the drain somewhere on the patient that's comfortable for the patient and easily accessible for the client so that they can change the Vacutainer reservoir on a daily basis. I just wanted to share this Vacutainer anchoring system that one of the hospitals I work with uses. It's brilliant. This is a hair tie that you can buy at the dollar store. They've cut it so it's just the right size to hold the Vacutainer. While the cat is still asleep, they've just put a stitch or two to hold the hair tie in place on the cat. And the Vacutainer can simply be placed within the hair tie, removed when you want to change it. Simple, no bandaging required. You know how cats love to be bandaged. This works so well. Thought I would share this with you. To remove this Vacutainer, simply cut your anchoring stitch and pull. Rarely do they require bandaging afterwards. I hope you found this video helpful. Please hit the like button and subscribe to our channel.